Everyone, today is Thursday, November 29th. Thank you so much for joining into our weekly healthcare reform webinars. I apologize for the technical issues already. As many of you know that have been joining us weekly, my name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. And we've been running these webinars for more than 5 years now and still have quite a bit to talk about. Today is no exception, even through the holidays. You know, fourth quarter is definitely notorious for being crazy, and that has not changed this year. So questions are encouraged during this webinar. Hopefully you can see my screen and hear me okay. If you can just raise your electronic hand and let me know that you can hear me and see my screen, that would be very helpful. Excellent. That is also the way that you ask questions. If you want to ask them live, you can raise your electronic hand, or you can type in questions in the question box and I'll answer those at the end of the webinar. So let's get started with the agenda. And again, questions are encouraged. So yesterday I had the privilege of meeting with our PAHU lobbyist, the Bravo Group, Margaret Durkin, as well as our PAHU Legislative Chair, Jessica Woltman, not to be confused with Jessica Altman, our Insurance Commissioner, and a couple other PAHU Leg Chair members. We met up in Schuylkill Haven with Representative Mike Tobash. He sponsored the 1605 House bill last session, which would allow agents to charge a consultation fee for individual and family sales if the carriers aren't paying compensation. And of course, we all know that compensation is only paid for the ACA market during the open enrollment, so 1/1 effective dates only. 2/1 through 12/1 effective dates, obviously there's no compensation. So hopefully this bill will be re-energized. When it was introduced, there was a hearing from the Health Insurance Committee at the Capitol, and unfortunately it just kind of died very quickly. A lot of folks feel that it's the responsibility of the carriers to pay compensation, and they have actually increased compensation for the 2019 sales. However, we still are left again with those February through December effective dates with special election periods and no compensation. So he's going to allow us to do a lot of the legwork and make suggestions in the language where it was held up. The broad language was held up last time. So I'm pretty encouraged, and I hope this comes to fruition and we can all have some help in earning some revenue from these individual sales. As many of you probably heard last night or yesterday, CVS Health now owns Aetna, and it was a $78 billion acquisition. CVS is paying $70 billion to Aetna shareholders, and it's also taking responsibility for $8 billion in Aetna debt. CVS Health said it will operate Aetna as a standalone business unit, and they said it will make new products and services available to the entire healthcare marketplace, regardless of one insurer, pharmacy benefit manager, or pharmacy of choice. So I think a lot of changes will be coming. We'll see what that brings for 2020. Obviously, it's not going to do anything to affect the 2019 individual and family markets or any other market for that matter, but it is something that I thought you should be aware of. Short-term limited duration insurance, questions on approval. We did hear back from the Pennsylvania Insurance Department, and the carriers do have to file for the 364 days. So I did pass that on to the carriers that were marketing, or the carrier that was marketing the 364 days in Pennsylvania, and hopefully they are refiling. Until they're refiled and approved, our response is that we are pulling that information from our site. Unfortunately, as I've mentioned many times, I do think the short-term limited duration program is the right answer for a whole heck of a lot of folks. And it's unfortunate that, you know, here in our Commonwealth, we are held to the 89-day ruling. So hopefully that can get approved, but it's not looking very favorable. We talked about this last week. NEPA, the Blue Cross of Northeastern PA, BOR news, they will be honored in 2019 for non-brokered groups. They'll follow the 10th of the month versus the 11th of the month rule for the commission takeover. Essentially what that means is if you send in a BOR and it's received before the 10th of the month, you will become broker of record the first of that month, the following month. And if it's received after the 11th or after, it will become first of the month effective after 30 days. So hopefully that makes sense, but it is an opportunity. There are a lot of non-brokered NEPA groups, and if you are knocking on doors or having any sort of marketing campaign, take that BOR, because now certainly it benefits you to do so. Group health submission deadlines, the December notice is attached. Also attached is our Colonial Life URL Jumpstart. That program has been running since September, and it is coming to an end on December 31st. So if you have any groups that you want to talk to our Colonial Life reps about for offering voluntary benefits, it's a no-brainer. It's an easy process. They go out and complement your sales, and of course, you know, you sit back and earn the revenue, and you can earn a bonus as well. So hopefully you take advantage of that. If you have any questions about that, let me know. Moving on, Aetna AFA customers received a New York State Office of Pool Administration communication regarding their New York HCRA filing. And what Aetna is saying, that there's no action that is needed. As the third-party administrator, Aetna will file the New York HCRA forms on behalf of the small group AFA customers. So there is no action needed on that. So if you get a call from one of your AFA customers, let them know that. Also effective 1/1/19, Cap Blue Cross groups in the 2 to 50 market can offer an employee assistance program, EAP program, through Mazzitti and Sullivan, and that is at no cost. There's information in the newsletter today. Employers can call Mazzitti and Sullivan at that number listed. The information is also again in our newsletter. They can call anytime after January 1st for a short setup call. The program will be available to employees the same day they call. The EAP will be available starting January 1st, regardless of when their Capital Blue Cross coverage renews. So, you know, these programs are becoming very, very popular. The EAP programs really are just kind of an additional line of support that if your clients, employees of your group clients are experiencing any life issues, financial issues, etc., they can call and get assistance free of charge and get referrals to folks that can help them. So it is something that's timely, and again, no cost. So it's a value add, and certainly something that you can discuss with your clients. 2019 individual information is on our site. That's been on our site. The INSX quoting portal is on there too. So you are able to quote and get estimated subsidies for on-marketplace plans specific to, you know, your client's age and zip code and county, etc. But please note that even though there's an Enroll Now button, you cannot click that button and seek to get enrollment. The enrollment button gathers the information that would be required for the marketplace, but it goes nowhere else. So please don't enroll using that link, because your clients will not have coverage if you do so. Commission retractions for the under 65 and over 65 med subs. It is a real mess. We got another statement in with a lot of issues. So I will continue to let you know that we are at the mercy of Capital and these audits and the retractions and their information. But we are going through the the statements very carefully to make sure that we were paid before we retract, etc. But things will fall through the cracks. So I want you, as I've mentioned before, to review and compare with your November statement. And unfortunately, it's going to have to go into December because there are a lot of issues. So check out your statements, know what you should be paid, and reach out to Brandy and her team with any discrepancies. Thanks. Fourth quarter call volume is heavy, obviously. It is the time of year. We do have a group health resource page on our site. It is packed with information that you would need on what you need to quote for each carrier in each segment of the market, and also all the forms that you would need. So if you are calling in and are experiencing a delay in response time, you can always go to our site for additional forms if that's what you're calling for. But fourth quarter's almost over, and I think we'll be well on our way. So we talked a little bit in weeks past about the change as of January for our format to our webinars. So we will have an inaugural Gemini weekly sales and legislative webinar. The first one will be held Tuesday, January 8th at 9:30, and it will be held every Tuesday thereafter. The weekly webinars, as we know them now, will change to monthly healthcare reform webinars, and they're going to be held. The first one is going to be Thursday, the second Thursday of every month, but the first one is Thursday, January 10th at 9:30. So I wanted you to be aware of that as well. More information will follow, and of course, weekly we send out our upcoming events schedule, so be mindful of that change. Pardon me. Let's see what else we have to discuss. The individual market, Highmark, in the newsletter, you'll see that they are creating a marketing campaign for 2019 post-enrollment for all ACA members. And basically, it's an outreach program to help retain the business. They will be getting application confirmation and payment confirmation emails, ID card messages, links to create their own member website, to enroll in that. They're also going to be doing some health risk assessment calls to identify those members that are eligible to enroll in a case management, disease management program. So they really are engaging the customers, and I wanted you obviously to be aware, because your customers are going to ask you why they're getting calls from Highmark, and that is the reason. They are engaging these clients. I think ultimately it's going to benefit you if you are selling Highmark programs, so that those clients maintain coverage as opposed to lapsing. There was an interesting stat out that I saw yesterday that enrollment is down about 13% nationally in healthcare.gov. Obviously, that could be for the short-term programs, but it could be that people know that there is no a zero tax penalty, and they're just going to go uninsured. So that is a trend that we should watch. Hopefully that 13% reduction in enrollment means that they're enrolling in a plan that's more affordable or more appropriate to their needs, but time will tell. So that's it. That brings us up to our open discussion and any questions. Our next webinar will be held Thursday, December 6th. So let's see if we have any questions. No questions at all. That is good, I believe. I just wanted to mention too that if you need any help or have any questions, you can always reach out to me. But the picture of a little baby here, this is not Elise is baby, but I wanted to mention that Elise will be out on maternity leave starting next week, the end of next week actually. So reach out to your case managers, and I'm available as well. But she will be on maternity leave having her baby girl, and we're all very excited about that. So that's it. No questions, so that will end our webinar for today. As always, I very much appreciate you joining in every week, and thank you for your partnership and your continued business. I wish you all a great balance of the week and a wonderful weekend. Bye-bye.